Okay. Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss some important reading tips, especially part B and C. Okay, so now I will allow you to unmute, okay? But all of you know. So those who have background noise, please try to keep yourself muted, okay? Just 1 minute. Can you hear me? Okay. Good morning, good
Yes,
evening,
sir.
doctors,
Good
nurses, and
evening.
pharmacists. Good evening. I'm Dr. Che, and today we will
Good
discuss some
evening.
important reading tips, especially reading part B and C. So, so let us not waste your time. Let us start right now. So, as you know, good evening. So, anybody can just quickly recap how we do reading part B, especially, and you can also part C also because almost strategy is the same. So, how we start and how we do the reading. Just quickly, please. Who can recap? Who can recap? No one? Okay, I'm going to recap. If you can't, I can. Okay. So, first of all, it's very easy. First of all, okay, read the question. Okay. Can anybody hear me?
Yes, sir.
Yes,
Yes,
sir.
sir. Yes, sir.
So, I think there is no issue from my side about the voice. Okay. If someone has any having issue with voice, you can try watching this video on Facebook page. Okay. Because I'm live on Facebook page also. Okay. So strategies, first of all, you will read the question. Okay. Mostly they will give a little bit a sentence here as this is just for practice. So I written short, sentence here. So mostly you will have one sentence here, just asking a question. You can read that question. After that, many people, they go straight forward to the text. Okay. They read the text quickly, skim and scan. Okay. How they skim and scan? They read the first sentence. It gives overview about the you know about the text, okay, what this paragraph is about quickly. Then this just quickly see the main things, okay, any heading, subheading, any date, any digit, any main thing in every sentence, okay, the main things quickly skim and scan. Okay, someone saying no voice, but I think you can hear me. Again, can you hear me?
Yes,
Absolutely. Yes. Yes,
yes,
sir.
sir.
We can hear
We
Okay,
you.
can hear. We
Yes,
can
sir.
hear.
Sir.
okay.
Yes, sir. We
So if
can
there
hear.
is an issue on my side, just you let me know if you can't hear me. Okay. Okay, after reading, this is one strategy. Other strategy, then after skimming and scanning the text, okay, sometimes they read also if the quick reader, then they see the options and they select one of the options. This is one strategy. Another strategy is read the question, then read the options, then go for the text. So skim and scan and see the answer. Okay, so these are two strategies. Okay. So, so please, you have now 3 minutes to find the answer for this question. Okay, this is just like reading part B, but overall, the discussion we will do after the class, after you do this, that would be for reading and B and C also, both parts. Okay, so 3 minutes to answer this question. Okay, your time starts now. Okay, so I'm waiting for your answers. You can just give the answers, okay? In the chat, please. No discussion. After that, we will see. I'm getting answers. So we are waiting for people to answer the question and then we will discuss, okay? Yeah. So people, those who are on Facebook, they can also comment. Okay. So who wants to participate? Some of you have given the answer A. Just a few of you and most of you have given the answer C, and only some have given the answer. This question is a little bit good quality wise. The real exam questions are similar, okay? A little bit twisting, but are easy. Can anybody unmute and talk with me about your answers? No? Anyone wants to participate? Can unmute. You can unmute yourself. No? Can you hear me?
Yes.
Yes, sir.
Okay. Okay.
Yes, sir.
Okay, good, good. So anyone wants to participate?
Sir, kindly explain this. After that, we participate in a discussion.
Yeah, I will explain. This is what I'm explaining. So can you start? Okay. So recommendation for physicians of United States. Okay.
I think,
Just
as you mentioned before, we have to read first sentence and the answer somewhere here. That's why
yeah, that is okay. But now we're discussing the exact answer. Okay.
I think here I will
Yeah.
line.
So the first question, in the first question, they are asking about only new guidelines. These are guidelines that are established. Please don't write on my screen so I can discuss. Okay. So the guidelines that are established for doctors, for physicians, in that guidelines, only new guidelines are sufficient to improve public health. Okay. So where this answer is given, can you just write in the chat in which line? Just write the line. Okay.
Okay.
Okay, so which line, Miss Ranjani? Please, you can stop your video if you don't mind. Okay, last line for fifth line. Okay, last line. Don't, but they should be used with care and understanding to continue such which result in new knowledge and recommendation. Arguments reflect best understanding of science. No, no. Your answer is here in the start. Okay. You should encourage to review not only the needs of individual patients they see, but also of the population in the community they serve to determine where specific recommendations need to be implemented systemically in their practice. Okay, no, the answer is not here. Okay. Review contained in this document are for screening, chemo process and counseling, still not. They do not necessarily apply to patients who have signs and symptoms relating to the particular condition. Okay. These recommendations are provided only as assistance for whereas regarding the care of their patients, as such, they do not substitute. Okay. As with organic reference sources, they reflect the best understanding of, okay. So your answer is almost in this part. Yes. Miss Ranjani, please, you can stop your video if you don't mind. Okay. 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 So where is the answer? So only new guidelines are sufficient to improve public health. Okay. So they reflect the best understanding of gas mass at the time of publication. They do not should be used clean understanding that they can receive a result. Okay. No, they are not saying these guidelines are the only one. They are saying that these recommendations, these recommendations refer back to? These recommendations is referring back to
Specific recommendation.
new guidelines. Okay, means new guidelines. Okay, so these new guidelines are provided only as assistance for physicians making clinical decisions regarding the care of their patient. As such, they cannot substitute individual and a judgment of the doctors. Okay, only new guidelines are sufficient to improve public health. Yes or no?
No,
No.
No, very good. So why no? What else we need apart from
only as was
guide?
written only as assistance for physician.
Yeah, only assistance. But what else we need apart from guidelines? What else we need?
We need an experienced physicians
Experience
as
of the
well,
physician, individual judgment. Very good. Okay.
and their skills about clinical decision and
Yeah.
their diagnostic.
Uh, yeah. So if I change the same sentence into new guidelines are important to improve public health, you will say true, false, not given.
It's false because
No, it's not false. They are important to improve public health, but not only. I'm not now using
no.
only. Okay. So
Yes.
if I remove sufficient and only these two things, then the sentence is almost okay. Okay. Because these new guidelines are helpful. Okay. In improving public health.
Sorry,
No,
Dr.
second
Chi.
sentence. Why it is wrong?
Sorry, Dr. Chi. It is I is where's I? You said it is not false, so it is where's I?
Sorry.
Where is the sentence regarding new guideline? New guideline. Speaking about new guideline.
Okay. Physician in reading, they don't give you exact age, especially in part B and C, they don't give all things in one sentence. Okay. You have to correlate the text with each other. Okay. It's a good question that you have asked. Okay. You have to correlate the text overall, the complete paragraph, the complete text with each other. Okay. Physicians are encouraged to review not only the needs of individual patient they see, but also of the population in the countries where they serve to determine which specific population recommendations need to be implemented. So now they're talking about specific population recommendations. Okay. Guidelines. Recommendations, you can use the word guidelines. Okay.
Okay.
Okay. Need to be implemented systemically in their practice. So apart from their individual experience, we need specific population recommendations. Okay. No, the recommendations about a specific recommendations. So those recommendations that are talking about this text, okay, are of screening and counseling only. They is referring back to these recommendations or guidelines. Okay, they are not necessarily applied to this and that. Okay, these recommendations, no, they are referring back to those recommendations, guidelines to improve public health. Okay.
Okay.
Dr. Farman, please, you can stop your video if you don't mind. Okay. So these recommendations, these new guidelines, these community guidelines, the guidelines to improve public health. So you can use any of these synonyms or similar words. Okay. Guidelines to improve public health, specific recommendations, okay, for public health, like this you can show. So these recommendations are provided only as assistance. Okay, now they're talking about this answer. Still you are confused about first option, to prove as false, true, false are not given.
Which one, sorry?
First one, A, option A.
A is false, I think.
Is false. No, is false. Okay. No, next. Next is almost the same place, specific population recommendations. So instead of now asking about
False.
guidelines, now I'm saying the word recommendations. Okay. Specific population recommendations are the best alternative for physicians' experience. Okay.
False.
So is false. Okay. Where it is given?
Yeah. It's the same as on second line.
Yeah. So this part. Okay. So as such, they do not substitute the individual judgment brought to each clinical situation by the patient physician. As such, okay, they. No, they. This is not like reading part A, in which mostly you can find the one sentence. Okay, so here you have to correlate the things with each other. So as such, they cannot substitute. They is referring back to
Specific
these
recommendation.
recommendations. Okay, recommendations. Okay,
Yeah.
so specific recommendations are not the best alternative for physician experience. Here they are saying they only serve as assistance, and they do not substitute for individual judgment. So this is just paraphrasing of the same thing. Here they're saying they are not
Alternate.
the substitute. So when I'm saying they are not substitute for something, so which one is better, the clinical experience or these guidelines?
Both of them. Both of them.
Both of them are important. Which one is better? Which one is, more important than the other one? Clinical
Guideline.
experience.
Guideline.
Clinical experience.
Clinical experience more.
They are saying these
important.
recommendations, these guidelines cannot substitute for the individual judgment. Okay. So if the same sentence B, I change into, so individual judgment is the best option to deal with the public health. Okay, like this. So then you will say it is okay because individual judgment of a physician is better. Okay, and these guidelines, they cannot substitute, okay, the importance of individual judgment. This is overall similar language, okay, paraphrasing these things you can say. Okay,
so it means it is the physician judgment is the best, then as assistant is a guideline. Yeah, you mentioned.
yeah, you can say primary thing is clinical experience of the doctor, and secondary thing is these recommendations. If you join both of them together, then you can improve public health. Okay,
Okay.
in better way instead of just with clinical experience. Okay, no, option
So
number
C
C.
is C, I think, correct one.
So where the option C is given?
Implemented.
And second line of the paragraph.
Second and third line.
Implemented, yeah. Third line, yeah.
Second line of the paragraph.
Second line.
Third lines and needed to be implemented.
Population in the community, they have to determine which specific recommendation need to be implemented systematically in their practice. Okay.
So the correct is C, yeah?
Yeah.
Yeah.
Correct is C, but where you can find the answer in the text?
Third line needs to be implemented systematically in their practice. This one.
Just let me tell you one thing. In here, in reading part B and C, it's not like just matching the keyword, just matching a few words. Okay. It's overall whole meaning. Sometimes they give, what this text is talking about. Okay, the main heading. What would be the heading for this text? Okay, or you can say, what is the theme of this text? Even sometimes the question could be like this also. Okay, So it's not like reading part A.
No, it is not just matching the keywords, but
Yeah.
it is mostly match with the what they ask,
Yeah,
what they
overall,
want.
you need
Yeah,
to understand the text, okay? You need to
yeah,
understand the complete paragraph almost, okay? Just quickly because you don't have so too much time, okay? Quickly understand the paragraph, okay? In this paragraph, overall, they are saying that these recommendation with the doctor's experience, they should be improved. They should be implemented together to improve public health, okay?
yeah.
So, in last line, they should be used with a clear understanding that continued research may result in new knowledge and recommendations. No. So they are not talking about the thing that is in the part C. In the here they are talking about these guidelines are not the full and final things, okay? With the research, with the time, they keep changing, okay? So you need to keep in mind that this with continued research, these things and new knowledge will come, new recommendations will come, okay? But overall, they are saying, okay, here in this first sentence, in third and fourth sentence also, they are saying that with a doctor's experience plus these recommendations, these guidelines, you can improve public health. Okay.
Okay.
Anyone has any questions so far?
No, thank you.
No
No, thank
question.
you.
Okay. Okay. Next is so this is the next question, and you have 3 minutes to answer. Okay. You can write in the chat. You should write your answer in the chat. You have 3 minutes to answer this question. Okay. It's like reading part B. Okay. Your time starts now.
Okay.
Option C.
Just wait. He's waiting us.
Okay, let me see your answers in the chat. C, B, C. Okay. So B. Okay, let us wait a little bit more, okay?
बता रहे हैं इसका। हाँ so C.
Sorry, maybe I changed to B.
Oh, yeah, I'm a little bit confused also between B and C.
Yeah,
So
B. I was
yeah,
changed to B.
I need
C.
to little bit rearrange the question, okay? So A is clearly wrong, yeah?
Yeah.
Yes.
Because A concludes that current evidence is insufficient to assess the benefit and harms of clinical breast examination for women aged 40
40.
years or older, okay? All family physicians should discuss advantages of CB to women of only 40 years or above. So this is not, okay? So there is no evidence of any benefit or harm of clinical breast examination, okay?
Yes.
No, this is family physician should discuss with each woman the potential benefits and harms of breast cancer screening tests, okay? So one of them is also clinical examination, okay? And develop a plan for early detection of breast cancer that minimizes potential harms, okay? Benefited by the recommendation discussed in the text below, okay? These discussions should include the evidence regarding screening test, the risk of breast cancer, and individual patient preference. So recommendation below.
وش فيك هو واحد وين
Please mute, okay? These are the patients who will solely be benefited by the recommendation discussed in the text below, okay? These recommendations, okay? The discussion This discussion, these recommendations, okay? Include the evidence regarding each screening test, risk of breast cancer, individual patient preference. Okay? Below are based on current breast tests as the summarized university can help to guide physicians and patients. These recommendations are intended to apply to women who are not at increased risk of developing breast cancer and only apply to routine screening procedures. Okay. Only common ways of screening are eligible for the recommendations. Okay. These are the patients who will solely be benefited by the recommendation discussed in the text below. B. Okay, so who will go for? Most of you are saying B, some of you saying C, but none of you said that it could be
I-
A. Okay. The current evidence is sufficient to assess the benefit and harms of clinical breast examination.
But B, you are not writing about eligible. You are just talking about benefit of recommendation. That's why it's C should be.
Okay, these recommendations are intended to apply to women who are not at increased risk of developing breast cancer and only apply to routine procedures.
That's why
Only
they
common ways of screening are
nothing about
eligible.
eligible for recommendations. But who can get benefits? You mentioned that.
Okay. Maybe B. Okay. These are the patients who will solely be benefited by the recommendation discussed in the text below. Okay.
Yes,
Each
I
benefit
think
should discuss with each potential benefits and harms of breast cancer screening tests. A plan of early detection of breast cancer that minimizes potential harms. Okay. These discussions should include the evidence regarding each screening test, a risk of breast cancer, and individual patient preference. Okay. These are the patients who will solely be benefited by the recommendation discussed in the text below. The recommendations below are based on current best evidence as summarized by this guide. Maybe there is some other text. No,
I think B.
it looks B. Okay. The patients who solely be benefited by recommendation discussed in the text below. Apply to women who are not at increased risk of developing breast cancer and only apply to routine screening. The author will include that.
everyone has this permission to have a screening, not just some of them who is eligible.
This recommendation was written are intended to apply to women who are not at increased risk of developing breast cancer and
Everyone.
only apply to routine screening. Routine, it means common way of screening.
Yeah.
I think it is B, but I'm not sure.
Only one way of screening are eligible for screening. They are the patient who were solely benefited by the recommendation discussed in the text below. So what is the recommendation in this text below? Okay, so physician should discuss with each woman the potential benefits and harms of breast cancer screening tests. Develop plan for early detection of breast cancer that minimizes potential harms. Okay, these discussions should include the evidence regarding each screening test, the risk of breast cancer, the recommendation. For me, it looks B. I'm not sure no because I discussed these a long time ago. So we can make it a little bit clear.
Yes, please.
Okay, just wait a little bit. I will make it clear. Okay.
Sorry, this discussion for C recommendation discussed in the text below. These recommendations are for a low risk, for those who don't have risk for breast cancer. Yeah, I think.
These recommendations for those who don't have risk for the cancer.
Yeah, they are not at high risk. This is for
Okay.
those who don't have a high risk of breast cancer, I think. Was written
Okay,
for
let,
yeah.
let me see, please.
Okay. This is very confusing.
This is not only confusing. This is how when we make the samples, okay, it takes time. It takes time. It takes a lot of effort. That is why you don't have a lot of reading OET reading samples. Okay, even after such a long big struggle, and then the people copy and they start sharing
And
for free.
nobody knows where these questions come. Believe me, are very confusing. Yeah.
No, I will make it better, but just I'm saying how it takes time and effort. Okay.
It needs this type of question. It needs 10 minutes at least. Believe me.
No, I never say these type of questions are like the real exam. Okay. They're just for the
Yeah.
practice. Okay. So in the
I know,
previous
but they
question, I
have.
told you, in the
Yeah.
previous question, I
These
told
are
that
only
is like a real.
these are the
excuse
only
me.
sample questions.
So these are my own samples. I have made this just to teach you
Okay,
how
that's
to
why.
do the reading and how to see, how to search the answers and these things. Okay, how to attempt the reading.
Yes, but these type of questions your sample questions are very confusing right
No,
now.
they're not. No, they're not confusing. In this here, we are
But it
confused between
takes
B
too
and C.
much time.
Yeah, it takes time, and
No, sir.
this is
Here
how
we
you should
can.
explore.
Sir, excuse me, we can skip the
Yeah,
B answer also, no? Because, sir, here they ask eligible for the recommendation. Though, so the B answer is only common way of screening, no? But in the 1, 2, 3, 4, 5, 6, 7, 8 paragraph, sorry, 7 paragraph,
line. Yeah, line. Yeah,
yeah, these recommendations are instant to apply to women who are not at risk, increased risk of developing breast cancer, and only apply to routine screening procedure. Here only mean we can apply to routine screening procedure, one of the option, and
yeah,
women who are not. So there are two. So here
yeah,
mentioned the answer mentioned only is another only here. So we can skip the B answer as well, sir. I think so.
yeah.
Because
Maybe
I
like
agree.
this. Okay. Only common ways of screening are eligible for the for the recommendations, uh, and only apply to. Okay, these recommendations that they have discussed here. Okay, these recommendations are intended to apply to women who are not at increased risk of developing breast cancer and only apply to routine screening procedures. Okay, only
Yeah,
common
there
ways
are
of screening
two.
are eligible. Yeah,
Yeah, two planned, not only. Or the
yeah,
answer is only common way of screening. So we can't tell
yeah,
only for the routine screening procedure. At the same time,
yeah,
women who are not at increased risk now. So here there is
yeah,
two option. So that's why we can reject the B answer. Yeah.
yeah. The only common ways of screening are eligible. We should change a little bit, okay? Only common ways of screening are eligible for the recommendations. Uh, Only comes on screen are eligible for the recommendation.
But our real exam is more difficult than your exam.
Yeah. Yeah. No,
It is
just
more
you know,
difficult.
as we have not practiced these things, so once we made a sample, then we need to discuss a little bit so that we can justify everything is okay. So this is not in the market, okay? This is just with me
No,
for
we
these
know it is not
recommendations.
your blame. We don't blame
Yeah,
you. I think
yeah.
real exam is more
Maybe
difficult.
maybe when I made this sample, I had something in my mind, okay? But as
Yeah.
I even don't have an answer key for this, okay? I didn't make any answer key, okay? So maybe when I made this, I might have something in my mind, but no, I don't remember because I made this sample more than 2 years ago. For these recommendations, these recommendations intended to apply to women who are not at increased risk of developing cancer and only apply to.
Sorry, the synonyms, if you know the synonyms, here instended and eligible. Both is
Yeah,
the same meaning here. If you know both are same, so we can skip the B answer. So the
yeah.
recommendations are instended. Oh,
Yeah,
and the screening are eligible. The both are. I don't
yeah.
know, sir.
Let me try, okay. For these recommendations, routine, for these recommendations,
Like to you asking the seventh paragraph. Which one, sir?
no, yes, I'm making, I am changing, I am trying to change, make it clear, okay.
Paraphrasing. Okay, sir.
Yeah,
Okay.
I'm trying to, do change the question a little bit. Eligible for recommendations. These recommendations intended to apply to women who are not at increased risk of developing cancer and apply to a routine blood screening procedure. These recommendations only common ways of screening. Yeah, we know bit clear, okay. Only common ways of screening are considered for the recommendations without a risk assessment. Okay. These are the patient. Okay, someone is excluded C is not solely beneficial. Excluded C because it's not only beneficial. Okay. These are the patients who will solely benefited by the recommendation discussed in the text below. The recommendation intended to apply to women who are not at risk of lying and apply to routine. We conclude that current evidence is insufficient to assess the benefit and harms of clinical assessment of hormones. Okay. Can help to guide physicians, patients. Evidence as summarized by the tests. Okay. Should discuss with each woman the potential benefits and harms of breast cancer screening tests and develop a plan for early detection that minimize potential harms. Okay. Regarding each screening test, these discussions should include the evidence regarding each, the risk of breast cancer, individual potential preferences, individual patient preferences, the recommendation, current best evidence as summarized by universities, and can help to guide physicians and patients. These are the patients who are solely benefited by recommendation discussed in the text. Yeah, someone saying C, we can skip C because these are patients who will solely benefited by the recommendation discussed in the text below. This is not true. Okay, they can be benefited by other things also, tests.
Yes.
Okay, other things also, but still the things are not in the clear in the.
So B is the correct one, yeah?
Then I have changed now the B. Okay, now I'm saying without risk assessment. So I will make it clear. Only with screening are considered for the recommendations. Okay, so these are the patients who will solely benefited. So let us move to the next question. Okay, I will make it better tomorrow. Okay, I will make it better tomorrow. Okay, and we will discuss this question again. Okay.
Okay, yes.
For me, still, it looks that I made this C wrong because these patients will not only benefit from these recommendations. There are other things also. Yeah. So now let us move to the next question. This is your question and 3 minutes to answer this. This would be the last question today and you will have 3 minutes. Okay. So what is the answer?
I think A.
Okay, what is the answer?
I put A. I changed it
So
to
Dr.
A.
Lala
Yeah.
say A and Swad changes to A. Most probably option B. Someone else is saying. Okay.
I can explain why it's not B.
Is okay. So just let me see it. Okay.
Okay.
Yasin says A. Well, let me see where it starts. Okay. Okay. Starts here. Okay. Let me see. So Sarek says is not B. Dr. Sumer says B. Yasin A. S is saying C. Then B. Muzammil says B. Most probably option B. Okay. Someone is changing to A. Dr. Lala says A. Sumeda says B. Unknown says C. Muhammad Majid says C. Okay. Someone is changing to A. So B is second part. B in second part is wrong.
Yeah, that's why I changed my mind to A.
A. Okay.
Yeah.
Let us see the B. Okay. Option B. Is true, false, is wrong, or someone has given B also. Optical colonoscopy can detect those malignant growths which are missed by other tests. Okay, where it is given?
Optical,
Colonoscopy.
yeah,
So
there. Yeah,
yeah,
yeah.
you match the keywords. So once you start finding the answers, then you will see it is easy. Okay.
Yeah.
Yeah. Let me see. Okay. There's no problem with lighting also. Okay. So in after option B, the first half, optical colonoscopy can detect those malignant growths which are missed by others. Okay, it is given here. So it can be performed for frequently flexible surgery, okay, and may detect precancerous lesions which would be missed by other tests. Okay, this part is given.
That correct one, yeah, that correct.
Yeah.
However,
And
however,
results in
yeah.
absolute decrease in mortality, and however, the incremental mortality benefit is uncertain. Okay.
So this is
So they are
wrong because
saying,
of it.
it results in absolute decrease in mortality. Here saying there are no evidence. Okay, so and increase in mortality is uncertain. Okay, so means they are not sure about the change in mortality. Okay, if it is increased, decreased, okay, or remain the same. Okay, so option B is wrong. Okay,
Yeah.
option B is wrong. Okay,
Yeah.
then let us go to C. Okay, let us go to A. Both CT. Okay, let us go to B. A. Okay, both CT colonography and FIT DNA have insufficient evidence of harms. Okay, no, here this is not like reading part A where you will find the answer in one. So you have to find where they give answer to the harms of CT colonography and the harms of FIT DNA. Okay, so here the FIT.
It is the last three sentences
Okay,
from the beginning. Yeah.
so no, they are given at two places. Okay,
Yeah.
last three.
Yeah.
Okay,
DNA has
okay,
a
so here.
handful of, yeah.
Okay, is associated with greater harms.
Insufficient, yeah. CT colonoscopy.
If both CT and FIT DNA, okay. Optical colonoscopy, okay, so they can be performed with a single focal subunit. Optical colonoscopy screen test can be performed less frequently than flexible. Which type of precancerous lesion would be so. However, the incremental mortality benefit is uncertain, so it is not given. Means this was wrong in B and is associated with greater harms. So both CT colono and FIT DNA. This is FIT DNA, okay? Fecal
Yeah.
immunochemical test has improved accuracy compared to FIT and can be performed with a single single fecal specimen. Okay. So now they are talking about optical colonoscopy. So this is CT colonography. Okay. FIT DNA. Okay. FIT DNA. Okay. So it is associated with the greater harms. Here they are saying is associated with the greater harms. Okay. So here they are saying there is insufficient evidence of harms. About
But if
CT,
you read, yeah, this one, if you
if
read
CT
this one.
exposes patient to radiation, and there is insufficient evidence about the harms, okay, of associated extracolon findings, and which are common. FIT DNA has a higher false positive rate than FIT and a higher rate of unsatisfactory samples than FIT, and information is lacking on appropriate screening intervals and follow-up intervals for patients with positive but a negative colonoscopy. Okay, here they are not talking about any risks, any benefits. Okay, in this sentence. So in this part, they're talking about in CT colonography. In CT colonography, there is insufficient evidence of harms. Okay, there is insufficient evidence about the harms of associated extracolonic findings. Okay, so this part about CT colonography has insufficient evidence of harms. That is okay, but
But
FIT
FIT
DNA,
DNA.
yeah, FIT DNA. Okay. Flexible sigmoidoscopy and guidance and this gas-based fecal occult blood testing FOT are the only screening methods which have reduced colorectal mortality in trials. Okay, fecal immunochemical tests have improved accuracy compared with this test. Okay, FOBT, and can be performed with a single specific fecal. Optical colonoscopy as a screening strategy can be performed less frequently than flexible sigmoidoscopy or stool-based tests. Okay, and may detect pregnancy lesions which would be missed by other tests. Okay, however, mortality benefit is uncertain associated with greater
I
harms.
think
Okay, so just 1 minute.
I think sir, C
FIT
is the
DNA,
more appropriate.
FIT DNA. Okay, this has a high false than okay, FIT has false than the FIT. A high rate of uncertain samples than FIT. Okay, now they're talking about these things. Okay, so FIT DNA, CT has insufficient evidence of harms, but FIT DNA has not have insufficient evidence of harms. Okay,
But what has information is lacking for FIT DNA.
FIT didn't know any no information is there.
no
Yes, there
information.
is no any information about that.
Okay,
Sir,
they are
C I
saying
think is more appropriate, sir. I think.
no, C is okay. C is okay. The evidence of harms caused by CT is and detecting growths out of colon is inconclusive. Is clearly right. Okay, is clearly okay. Your option is C. Okay,
Yes, sir.
correct is C. But now I'm just explaining why B is wrong. Okay, because when you're doing practice, you need to know also why other is wrong. Okay,
Sir, B is the second part.
just to improve your reading skills. Otherwise, you will be doing a lot of samples. At the end, there would be no improvement. Okay, this is the purpose of our class. Okay?
B
Yes,
is
sir.
not correct because of word malignization. Malignization when the tumor become cancer. That's why. But they are talking about
No, B is wrong also. B is wrong. We have already
B is
discussed.
wrong.
No,
B is wrong in
yeah,
advance.
yeah, B is wrong because there is no change in. They are saying increment. The increase in mortality benefit is increase in mortality benefit means decrease in mortality. Okay,
Yes.
so is uncertain. It means absolute decrease in mortality. So and results in absolute decrease in mortality is wrong. Okay, we're not sure about decrease in mortality. So B is wrong. Okay, now about
Yes.
A.
It's
Yeah,
could be because of
I
the
know
last
one.
sentence as
Yeah.
well.
FIT
FIT got a
information.
negative colonoscopy, insufficient evidence of harms.
CT colonography has insufficient evidence about the harms. Okay, so
Yes,
let
sir.
us separate them. Okay, CT colonography has insufficient evidence of harms. This part
Yes,
of the
sir.
sentence is correct. Okay,
It's
Yes,
correct.
now
sir.
we
Yes.
have another thing, that is FIT
FIT
DNA.
DNA.
Okay, FIT DNA test. Okay,
Yes.
Which is given at the last paragraph, last third line.
this is
So,
given here, but we are confused between optical colonoscopy and FIT DNA. Okay, how to relate them? Flexible sigmoid
sorry, Dr.
screening and
Chi.
yeah,
I can say right now why A is wrong because
yeah,
I
please.
chose A, but I think right now is wrong because um, if FIT-DNA has lack of information, not about harm, it's about screening interval, follow-up interval like this, but not about harm.
Yeah.
Yeah.
Okay.
But
Yeah,
although I
FIT
chose A,
DNA.
but right now I know it is wrong because it has
Okay.
insufficient lack of
Yeah.
information is insufficient evidence. Yeah.
Okay. Yeah. Let us see. Okay. FIT DNA is not given before that. It starts from here. Yes or no?
Yeah. Yeah.
Yes, sir.
As a higher false positive rate,
High
then a higher
unsatisfactory
rate of unsuspected samples. Information is lacking on appropriate screening
interval.
intervals and follow-up intervals for patients with positive FIT DNA but negative colonoscopy. So if you see throughout the text, okay,
Yeah.
throughout the text, only FIT DNA starts here, okay, in the
Yes,
last
Yeah.
sentence only.
Yeah.
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 yes, sir.
So CT colonography has insufficient evidence of harm that is given, but FIT DNA has insufficient evidence of harms is not given. Okay.
Yes, sir.
Yeah.
Yes.
Yeah.
Just insufficient evidence about screening interval, follow-up interval
Yeah.
like this. Yeah.
They
Yes,
just
sir.
they're unsatisfactory samples.
Yeah. So you have to find here. Just your keyword is FIT DNA. FIT
Yes.
DNA starts from here. There is not mentioned anywhere else. Okay. So it's not given here. Other thing was I was thinking, okay, optical colonoscopy as a screening strategy can be performed less frequently than flexible simultaneity or less tools may detect which would be missed by others. However, the angle mortality is uncertain and is associated with greater harms. Okay. If I change it, both say, CT colonography and optical colonoscopy have insufficient evidence of harms, then it is clearly wrong. Okay.
Yes, sir.
Because optical colonoscopy is associated with greater harms. Okay.
Yes, sir.
Yeah.
But could you show us ways detecting growth of colon? You didn't mention
Yes.
colon anything, I believe.
About what?
Out of colon, way grows out of colon. Like if you see text like answer C, detect
Yeah.
grows out of colon. I haven't seen this.
Extra colonic fine. Yeah.
Extra colon finding.
Okay, associated
Extracolonic findings. Okay. This is
Mhm.
paraphrasing
extra colon.
about, you know,
But it's not extra, it's just okay. It's abdomen.
out of colon.
Out
CT colonography exposes patients to radiation and there is insufficient evidence about the harms of associated extracolonic findings means, you know, the harm out of colon, the harms that it could cause to bladder, it could cause to other things is inconclusive. Okay. The evidence of harms caused by CT colonography in detecting growths out of colon is inconclusive.
Okay, I understand now. Thank you.
Yeah. C is accurate exactly, okay, 100%, and B is 100% wrong. C, this part was wrong. This part was correct, first part. The second part was not given. Okay? FIT DNA is not given. Okay.
Yes, sir.
So your option is C.
Yes, sir.
In the real exam, you can also get some options or some parts of the options, and it would be not given. Okay. but C was clearly correct. Okay, you will go for C. Okay. Any question? Anyone wants to ask any question? Any question? No questions? No, if anyone is,
No, Daddy.
you have to do anything, you can leave
और
now.
यार मुझे
If
कल बता
anyone is,
बल्कि बता रहे हाँ जी हाँ
please,
जी
yeah,
कराएं दो
please, mute, yeah. Alright. Okay. So if
करवाएं
anyone is on duty or you have to do something important, you can leave now. But now I will
वालेकुम
improve
अस्सलाम
this
क्या हाल है जी
question. I will improve this question in front of you.
यही शुक्र अल्लाह
Okay, you will improve.
When
I
will be
will
the
improve
next
this
class
question.
of?
Next class would be of writing. Tomorrow would be of writing. And day after tomorrow, we will do speaking.
Okay.
Yeah.
Are you planning to do part A too?
Can't you
No,
send
yes.
us your timetable so we can make our schedule according to that?
No, timetable is the same. The class is almost at the same time that we started today.
At 9:30.
Yeah, almost.
Pakistani.
Yeah,
Okay.
yeah, the timing is almost same. It can, 10 minutes before, 10 minutes after that, that is not a problem. But I didn't take the class 2 days before, 2 or 3 days ago, before today,
Okay.
because I was busy, okay? Otherwise, I will try to take daily. So now if anyone wants to leave, you can leave. Other people who wants to, who are free, let us try to improve this question, okay?
Okay.
आप इंजॉय करें आप सही है हाँ जरा सारा को अच्छे से मशीन लगाना सिखा दें
Please mute. No, we cannot cancel. We are already in
मैं
trouble
कहा
and
जब
you
इन्होंने
people
आना ना
start.
थके तो आप दोनों माँ बेटी ने कहना मेरा पुत्र थक गया बड़ा है मेरा भरा
Even I can remove from the
है
class,
से
but
तो मैं
I
कहा
should.
वाकई जब देख हाँ हम्म,
Okay, let us. Okay.
Roxana
No.
Yusuf, can you please mute your?
Yeah. She is out of class now. No, she will come again. Okay, if she is interested.
I think so.
Okay. So now let us try. I just want to show how we work in the background when we make questions. Okay. Just I want to
Okay.
show. There is no need to keep you in the class without any. Is it okay? So first was wrong. Okay. Our conversation should discuss wanted to discuss CBE to women of only 40 years old. Is was wrong. Okay.
Yes.
Only common screening are considered for the recommendations.
This was
These
also wrong.
recommendations are intended to apply to women who are not at increased
Increased
risk
risks.
of developing breast cancer. These recommendations are intended to apply to women who are not at increased risk of developing cancer and apply to routine procedures. Common risk screening is the only factor to be considered for the recommendation. The recommendation intended to apply to women who are not at increased risk of Recommendations are intended to apply to women who are not at increased risk of developing breast cancer. Protein blood. No, what I'm changing is this sentence. These recommendations are intended to apply to women. Those women who are not at increased risk of developing cancer undergo routine screening procedures. Okay.
Okay.
I'm saying common ways of screening. Now, this second part is also for the same woman. Okay. Those who are talking about to the woman, those women. Okay.
Okay.
Here you should mention the woman, the specific woman. Now we're talking about these. Okay. Common ways of screening is the only factor to be considered for the recommendations. Okay. These recommendations are intended to apply to women who are not at increased risk of developing breast cancer undergo routine blood screening procedures. Okay. Common ways of screening is the only factor to be considered for the recommendations. What you can say now, this. Okay. What you say about this? Common ways of screening is the only factor to be considered for the recommendations. What do you say about this?
So
Yes, sir. It may be considered as a correct answer.
What?
yeah.
It may be considered as a correct answer.
No. B is no wrong, correct or not given.
Okay, sir. Sorry,
This is wrong, sir.
Is wrong.
Yes, wrong.
Yeah, is wrong. These recommendations are intended to apply to women who are
Women who are not
not
yet
at
increased risk of
increased risk
not
of developing breast
developing
cancer
breast cancer
and
and
undergo routine blood
routine
screening procedures. So, common ways of screening is the only factor to be considered for the recommendation. No, this is not the only factor. There is another factor, that is these women should not be at increased risk of breast cancer. Okay. Yes.
Yes, sir.
Anyone still has any doubt?
No, sir.
I have answered to the woman means the specific woman. Number one, who are not at increased risk of developing breast cancer. Number one, and number two, who undergo routine blood screening
Screening.
procedures. Okay.
Hmm.
Common ways of screening is the only factor. Common routine screening procedures. Okay. Common ways of screening is the only factor to be considered for these recommendations. No. We need to consider if the patient is at risk or not. Okay.
Okay.
For these recommendations, patient should not be at risk, and number two, should undergo normal routine procedures. Yeah. So these are the patients who were solely benefited by the recommendation discussed in the text below. No. This was also part wrong. Okay? They will only benefit from the recommendation discussed below. You should discuss with each woman the potential benefits and harms of breast cancer screen test and develop a plan for early detection of the breast cancer with minimize harms. Okay. This should include the evidence this risk of breast cancer and individual profession. These recommendations are based on the current medicine as summarized by this. How to guide physician and patient. These recommendations are intended to apply to women and theirs. Okay. If it concludes that the current evidence is insufficient to assess the benefits and harms of clinical breast examination for women. Okay. These are the patients who will solely benefited by the recommendations. Okay. These are the patients who will solely be benefited by the recommendations. See? So let us delete this and now our C is correct, okay?
Yeah.
No, there is no doubt in C
Yes.
that it is wrong.
This
Is
sentence
correct.
is
Okay?
not
These
clear.
patients, no, it is clear. These patients will be, maybe when I made this sample, maybe I was trying to make the C wrong and trying to make the B correct. Okay, I don't remember now, it was a long time ago. So even I don't have key now also. So now C is correct. These are the patients who will be benefited by the recommendations discussed in the text below. Yes, they will be benefited by these discussions. Yes.
Yes.
Okay.
Yes.
So our family physician should discuss advantage and disadvantage of CBE to women of only 40 years or above. So if current evidence is insufficient to assess the benefit and the harms of clinical breast examination for women aged, so it is wrong. Okay, there is no benefit of these discussion for women of 40 or
Sir,
above. Okay, so this is wrong.
Sir, C is also wrong because it is not
See,
only you have removed solely.
I removed
Yeah,
only that
remove
we made this correct. Okay,
Okay, sir.
yeah, we remove only from here. No, these patients will benefit from these recommendations by any way. Okay. There are other things, but they will benefit from these recommendations. There is no doubt in C, okay? C is 100% correct, okay?
Yes, sir.
B, A is wrong because there is insufficient, the evidence is insufficient to assess the benefit and harms for this exam, the clinical breast examination for patients who are 40 or above, okay? So only 40 years or above, so there is no need of discussion because there is no evidence of advantages and disadvantages of CBE. Okay, A is wrong, C is correct. Okay, B is wrong. Common ways of screening is the only factor to be considered for the recommendations. No, this is not the only factor. We should also keep in mind that the patient should not be at increased risk of developing cancer. Okay, then they can benefit from these recommendations. Okay.
Okay.
Any question? Anyone wants to ask anything?
No, sir.
So that is good that you people try to understand how the examiner is working behind when you say in any movie behind the scenes, okay? How the things are
Yes.
going behind the scenes, okay? The things are behind the scenes like this, okay? So no, in this I'm trying to trick you. Just let me tell you, all family physicians should discuss advantage disadvantage of CBE to women of. So women is given advantage disadvantage given all family physicians or family physicians is given, okay? Okay.
But
So
not 40 years.
yeah, but they say there current evidence is
At the end,
insufficient.
yeah.
Efficient unless benefits and harms. Okay, so this is wrong. Here I have given one thing is correct and one thing is extra thing that is given there, but you cannot say only. Okay,
Yeah.
if you remove this only, then your B is also common
Correct.
way of screening is the factor to be considered for the recommendation.
For the
Yes, it should be
recommendation.
considered. Yeah, but this is not the only. Okay. If you say only, then it's correct. In the last sentence, we have removed only. Then no, there is no doubt that C is wrong. So it's clearly correct. Okay.
Yes, sir.
Yeah. So anybody has any question? Anything you want to ask?
No, it's clear now.
So thank you so much. So tomorrow we will do writing class, and
It's tomorrow
you
writing
can
or speaking
text
class?
writing. Tomorrow is writing,
Okay.
so you can send me. You can text me to get the case notes. Text me on WhatsApp. I will send you the case notes. You can write. You can send me. I keep your letters in order. Okay. The first one
Okay,
who
sir.
will send me the letter will be the first one to get the correction at the end of discussion of the letter. Okay. So if you send me earlier, your chances
Okay.
are more chances to get your letter corrected in the live class. Okay. Thank you so
Okay,
much,
sir.
all of you. Try to
Thank you, sir.
invite your friends for the free class so that we can get benefit. Okay. Thank you so
Okay, sir.
much. Thank you.
Thank you.